right. So thank you everybody for joining us this evening for our positive psychology talk about veterinary medicine and mental health. And tonight we have a panel discussion that I'll be moderating, and I will introduce everybody in a moment. But we will be discussing various scenarios and situations and discussing how to effectively navigate through patient, owner, and veterinary practitioner relationships, and exploring a variety of topics that have been real world situations experienced by both by veterinary practitioners. So that is the impetus behind this. And so I'm going to go ahead and introduce our panel today. So first we have Dr. Sarah Hoggan, who is our veterinarian, present veterinarian. And then we have two psychologists with us as well. We have Dr. Rachel Davis and Dr. Stephanie Lehto. Did I say that correctly? Yes. Okay. I just want to make sure. All right. Perfect. And then I am Dr. Barbara Cooke, and I am a criminologist with a background in psychology as well, and a avid dog lover. So that is my role in the situation. So I'll be moderating. So as I mentioned before, we're going to be presenting some scenarios that are representing frequently experienced, but real world situations that a veterinary practitioner can encounter in real life, or as a pet owner can encounter in real life, or a family member maybe navigating with their loved one. And we have some prepared questions that I'll pose to our panel, but then we also have time reserved for feedback and questions from the audience as well. So we would love to hear your thoughts and questions as well. Is there anything that our panel would like to? Yes, go ahead.
Quick clarification, in case I talk about medications, I am a psychiatrist.
I'm so sorry, psychiatrist. I apologize. I apologize. Yeah, so we have a veterinary, yes, a veterinary doctor, psychiatrist, psychologist, and random person. Okay. So, all right. Yes, thank you very much. Thank you for clarifying that. I apologize. So I will go ahead and begin with our first scenario that we have prepared. All right. So Sarah entered the veterinary clinic, her heart pounding with a mix of worry and anticipation. Clutched in her arms was Luna, her tabby cat, whose recent lethargy and decreased appetite had become a source of mounting anxiety for Sarah. The veterinarian greeted Sarah and led them into the examination room. As Sarah placed Luna on the examination table, her fingers fidgeted relentlessly, betraying her inner turmoil. The veterinary listened attentively as Sarah described Luna's changes in behavior, noting the urgency in Sarah's voice. Throughout the examination, the vet asked thoughtful questions about Luna's environment and recent habits. Her observations extended beyond the physical symptoms to the emotional connection between Sarah and Luna. It became increasingly clear that Sarah's own struggles with obsessive-compulsive disorder and generalized anxiety might be influencing her perceptions of Luna's health. So my first question to both Dr. Davis and Dr. Hoggan. I'm not sure who would like to go first, so please, I'll let you navigate that. But what are some of the common I'm so sorry. I apologize. This is actually to Dr. Davis and Dr. Lehto. What are some common manifestations of OCD and anxiety related to pets?
I guess I'll start, and then Stephanie, you can chime in. So I think people with anxiety or OCD may be more worried about the health of their pet than someone without anxiety. And sometimes this can show up as going to the vet or the vet emergency room more than someone else might. They might also have worries about whether they're a good enough owner or they're harming their pet in some way. And they may do like checking compulsions to make sure that their pet is okay. They may have difficulty leaving their animal home alone with more worry than someone else might, worrying that something bad would happen, or just worrying that the dog's going to feel bad, or the cat, or whatever the pet is. There might be concerns about contamination, like if someone has contamination related OCD fears. So like fearing that saliva or poop or any of that is kind of gross. I could keep going, but Stephanie, I'll let you chime in.
Yeah, I think a lot of times I think about the rumination and the hyperfixation that can happen when worrying about our pets. And so there can be a lot of reassurance seeking that is done. And so that checking behavior can happen. And then also seeking reassurance from our friends, our family, and seeking reassurance from a vet if you have a vet or a veterinary tech as someone that you are able to contact. Um, there also can be escalation of the concerns because an individual with OCD and anxiety might become very worried about something. And so they might start to think, like, let's say, for example, in this instance, there's the changes in the behavior for Luna. And so Sarah is checking Luna and being aware of it, and then might start to misinterpret some of those concerns and be really aware that something might be changing, and it might be that Luna is she might be responding to the frequent checking or something along those lines. So there can be some misinterpretation that occurs. And then there's also avoidance. I know that there can be a lot of checking and a lot of I want to get support and make sure that I'm doing the right things for my pets, but there also can be avoidance of going to the vet because of that fear that maybe I am a bad pet owner, I'm doing something wrong, or I'll, do something embarrassing or shameful, or they'll get more contamination on my pet. So those are other ways that there might be some anxiety and OCD showing up.
I think one other thing well, two other things, and then I'll let you move on, Barbara. But one, often people with anxiety or even other mental health disorders may have more difficulty forming friendships or other relationships. And so it's not uncommon that for my patients that their animal or their pet is their person. Mm-hmm. And so this animal may have a lot more significance in their life than to someone else who doesn't have a mental health disorder. And then the other thing that I think is important is a lot of my patients with OCD worry about death a lot more preemptively than people without OCD. And so even when their dog is a puppy, they may already be worrying about what am I going to do when my dog dies, how am I going to handle that, and have trouble even being present in the moment. So that's just another couple things to think about.
Perfect. Thank you. Thank you very much. And I think those are going to be recurring discussions further along as well.
And Barbara, your voice just got very soft. I don't know.
Oh, sorry. Let me make sure my mic is right here. Okay, perfect. All right. So the next, thank you very much for that. The next question I have is for Dr. Hoggan. So what are best practices for veterinary practitioners when working with anxious owners?
It's a multifactorial approach. I think the first thing you need to do is do a thorough physical exam and use your clinical skills to really determine that there isn't a problem. You don't want to discount what someone is telling you out of hand. Check the vital signs of your patient. Do a thorough physical exam. If they're saying something has changed, maybe they said, well, he's breathing differently. Okay, different can be good or it can be bad. You need to be thorough in your examination and make sure what they're telling you doesn't reflect a bona fide pathological change. Mm-hmm. The other thing you can then do is if it does appear like this is a healthy patient, but they're more concerned and that's what's bringing them there is their worry, then you can empower them with some basic techniques on how to quickly evaluate their own patient, their own mm-hmm. dog's health. Let them know what the normal vital signs are. What's a normal heart rate? So a normal cat heart rate is 180 if the cat's excited. Okay, a human with 180s, and oh my goodness, but that's okay for a cat. Mm-hmm. A cat that's hyperthyroid, their heart rate can go up to 240. So you have to know that there are species differences. Normal body temperatures for cats and dogs is 101 degrees. Up to 102.5 is still normal. So that's not a fever. that's why they feel so good to cuddle with. They do feel warm. Yeah, we're 98.6. So helping them to understand this is normal for them is useful. And then giving them a few physical exam tips that they can use. Show them how to take a pulse, feel the pet's chest. I'm reaching down on my dachshund to, this is right where you see my hand. I can feel her heartbeat. That's where you can check a pulse very easily. And you can look at the gum color of the patient. If their gums are naturally pink, then they should be bazooka bubblegum pink. If they look like grape bazooka, or if they look like white, well, I guess bazooka doesn't come in white, but if they were to look white, that's an oh my goodness. That's a get them to the hospital. So you can give them some very tangible, realistic barometers that they can use of health. And that can help them to recognize, okay, I'm worried about this. Let's check the breathing. Let's check the vital signs. If all the vital signs are normal and the gum color looks normal and the mentation is normal, then it's less likely to be something serious.
Thank you very much. All right. Are there any questions from the audience at this point? You're welcome to put questions in the chat, or you can unmute yourself and speak.
Sarah, I love that the first thing you pointed out was that the owners actually know their patients best.
Mhm.
I think we sometimes forget that we're an expert in animal care, but they're actually an expert in that animal.
Mhm.
So I do exotics, so I see so many different species. I'm like, I don't know if this is normal. You tell me. Like,
Yeah.
I've never had this species. So.
Mm-hmm.
Important. Thank you. Thank you very much.
Let's move on to the next one. We have 5
Absolutely.
scenarios, so
We do. I'm watching the time. Don't worry. I have a little timer here too. All right. So now we're going to go ahead and move on to our next scenario. So the atmosphere in the veterinary clinic was tense as Mark sat fuming, his frustration barely contained. His dog Max had been battling chronic illnesses for some time, Cushing's and diabetes. Now, with a kidney failure and a troubling bout of arrhythmia, Mark felt overwhelmed and concerned. Max had been rushed to the back when Mark brought him in. He had brought Max expecting a plan to manage the latest complications, but instead felt blindsided by the veterinarian's suggestion of euthanasia. Mark screamed at the receptionist and the veterinarian. The suggestion had come without the context he desperately needed. No discussion of Max's quality of life or potential interventions to stabilize his condition. To Mark, it felt like giving up on his beloved companion without exploring every option. All right, so my first question is to Dr. Hoggan. In retrospect, how could this have been handled differently to mitigate anger?
This is a pretty common scenario where to somebody who works in veterinary healthcare, based upon experience and patterns with other clients, you may look at a pet and think that I'm concerned that this pet doesn't, that they're reaching the end of their quality of life. And so that can come from, basically, you're coming from a sincere place, but what you need to do instead is when you go to talk to that owner, start the conversation with, what I need from you right now is some guidance, because I am very happy to go through a physical exam and diagnostic testing and hospitalization because your baby is clearly sick. And honestly, this is worrisome. This isn't getting into the worrisome sick category. This isn't a speed bump. This is a big deal. And I'm happy to go down that road if you want. Or if you feel like it is time to make some very hard decisions because this person, and yes, dogs and cats and birds and fish count as people when you love them. If they are not doing well and you feel like it is time to give them some peace, that is okay too. It is not that one decision is right or one decision is wrong. Whichever decision you make, because you are putting their needs first and it is a decision based in love, is the right decision. So in this scenario, if that had been the first communication to that owner, he would have felt valued, he would have felt validated, and he would have felt that he could probably talk with me honestly about what concerns he had, and we could have made a plan together. And if he had articulated something like, I don't know what I want to do. I recognize that he's not as good as he used to be, but I love him and I'm not ready to make an irreversible decision today. Okay, that's valid. Instead of making a plan that is a 10-step plan that we're going to put into play instantly, let's maybe make a 2-step plan. Let's maybe do a little bit of blood work and see if we can, just a minute, I have to intervene in an argument. Let's see if we could, maybe make a 2-step plan and get some answers, and then we can make some more informed decisions.
Beautifully put. And there was a second question about how to handle someone who is angry. But unless you have any further comments, I think you did discuss that, but unless you had any final thoughts or comments.
Well, I think part of it depends on the circumstances of the anger as well. Are they angry because of the way a staff member spoke with them? Are they angry because they've been waiting? Are they angry at the situation and you are just unfortunately in the path of those emotions? And the biggest mistake that people make in veterinary medicine is they recommend a treatment plan, and when they get pushback from the owner, they take it as a challenge or questioning their authority or questioning their motives. Like, you think I'm just about the money. No, that's not the case. Instead, the best thing that you can do, even if someone says something almost like they're trying to bait you into an argument, is don't take the bait. Recognize the circumstances are horrible. Someone they love is dying. It is completely beyond their control. And the best thing to do is take a step back. If you have to do it physically, do it physically. If you can only do it emotionally, that's fine too. And recognize the context of the comments, and then do your best to try to address the situation. If they're upset because they waited an hour, okay, acknowledge that. If they're upset because the receptionist said something that they took issue with, apologize on their behalf and let them know that you will speak with her, and then speak with the receptionist privately. If it's about their pet and they're angry with the situation, then again, you can always ask them for guidance and say, okay, you tell me what you'd like to do. I will do my best to use my expertise to help you. And just understand that your pet has diabetes, your pet has Cushing's disease, your pet is 14. No matter what I do, I cannot make them undiabetic. I cannot make them un-14. And Cushing's is incredibly challenging to regulate and get under control, and it's compounding the diabetes. And historically, when we had talked about this, that wasn't a financial reality, because there are other financial realities that have to dictate decisions in your life. Like, you have to be able to pay your rent, and you have to be able to eat, and you have to be able to make a car payment. And those are all 100% valid and reasonable reasons to be on the path that we're on. So acknowledge the person, acknowledge how hard they're trying and validate their feelings, and then try to move the situation forward in a positive way that helps the person and the pet.
Mhm. Thank you. All right. So my next question is for Dr. Davis. How do you treat the person with compassion, as anger is likely related to the situation, not to the care in the scenario presented?
So it always helps me to think of when I used to work in our psychiatric emergency room at our county hospital, and to remind myself that, even though I see 4 or 5 patients a shift that have attempted suicide, that for that one person and their family, that this is the first time it's happened. And so, you know, I think remembering that can help you have a little bit more tact and a little bit more compassion. Another thing I've also learned is a little counterintuitive, but one of the worst things you can do to someone who is angry and anxious and stressed and concerned is to talk to them in a very calm, thoughtful voice. Now, I'm not saying you yell back at them, but you need to match their urgency. You need to let them know that you understand that this is not a good situation, because talking very calmly just shows them that you don't really get it and you don't understand that this is a big deal. I think being flexible, a lot of human hospitals, but also veterinary clinics have policies. And for example, one of those policies is that, clients need to approve the treatment plan prior to doing treatment. But if you have an animal that is, let's say, a dog who's in a lot of distress and you're really worried that the dog is suffering, and the owner is saying, I don't care what it costs, I can pay anything, just do what you need to do. Maybe don't sit there and make them walk through, for 20 minutes every piece of the treatment plan because you just told them their dog was suffering. The other thing is, like, let's say that rounds are happening, and so you go in and you tell the owner that their dog is suffering and you're recommending euthanasia, but rounds are going to happen, and so in 30 minutes they can see their dog and make the decision. That might not be the best idea either, and so that might be a case for making an exception. Yes, rounds are happening, but also we're going to bring you back so you can see your dog, and maybe starting the conversation with, this is going to be really hard to hear, but, Max is back there and I'm really worried about him. We've tried to make him comfortable. I don't think he's comfortable. I really want you to come see him so you can make the decision now because I'm worried about waiting. And I think sometimes the owner actually needs to see their animal to understand that this is something that's time sensitive and it's not being rushed out of callousness, but their animal really is struggling.
Thank you. All right. And Stephanie, did you have any feedback as well regarding the treatment of the owner with compassion and in the context of the situation presented?
I have some ideas for the owner,
Yes.
not necessarily how we
Yes,
treat the
that's right.
owner.
Yes.
So I think that it's very hard when you're in those situations to advocate for yourself, but being able to practice advocating for yourself and having the tools to say what you need. So in Rachel's example, no, I need to see like my pet now versus I want to wait until after rounds. It can be really helpful to practice advocating for yourself or bringing a support person in who's also able to help. I know for myself, I would really benefit from having someone else there to help navigate that conversation because of how I'm feeling. And also really thinking about those worst case scenarios and how you may manage that. So this is as an owner outside the situation, like thinking about the different coping strategies that you might be able to use. Because a lot of times when we are angry and other people are kind of like reacting to our anger, it can be like a little back and forth. So learning different strategies to help in that while also still advocating for yourself can be really important too. And then also, I think that whenever I think about anger, I think about internalization of anger and how we can I'm feeling angry about this thing. And then after the fact, I did all of the stuff wrong for my animal, for my pet. And I could have done this differently. And maybe I could have done this. And instead of really focusing on this is something that I did, recognizing this is also a really hard situation where you have a 14-year-old pet who has Cushing's and diabetes, and it's really hard and we can feel sad about it, but it doesn't mean that it's something that we did wrong. So not internalizing it.
Yes, thank you. All right. Are there any questions from our audience members or comments?
And this will be posted on YouTube as well. And so if people are watching this on YouTube, any of you have questions or comments, feel free to put it in the comments below, and we will be checking periodically and can respond there.
Yes. Yes, perfect. All right. We're going to go ahead and move on to scenario number 3 now. All right. So the veterinary clinic was bustling with activity when Jamie arrived, his eyes darting suspiciously around the room. His cat Buddy was in his lap. Jamie's demeanor was tense, his mind clouded by delusions and paranoia. He believed that aliens had invaded Buddy and were planning to escape and infect him. As the vet entered the examination room, Jamie's agitation was palpable. He spoke rapidly about the alien threat, his voice rising with each sentence. The vet listened carefully, aware of the delicate situation. The vet was very familiar with Jamie and Buddy and knew that acknowledging Jamie's fears without reinforcing them was crucial. All right, so my first question is to Dr. Hoggan. What should a veterinarian do from their perspective in this scenario?
So it is critically important to recognize that you do not want to waste any time or any energy trying to argue with this individual and say aliens don't exist or aliens are not present in your cat, and take a flippant or in any way disrespectful tone. You need to understand that this is this person's reality. So even if it doesn't match your reality, it is their reality. And arguing with them or trying to convince them otherwise isn't going to be high yield and isn't going to help anybody. So what you are better off to do is ask him in a sincere and thoughtful way, what is it that is making you concerned that there are aliens? Are you seeing a change in bowel habits? Are we vomiting? Are you feeling something inside that wasn't there previously? Are you noticing things coming out of the rectum after a bowel movement? Because tapeworm proglottids or other parasites can absolutely do that. So there can be real fixable or treatable conditions present that the owner is noticing. They may be attributing those clinical signs or those symptoms to something that isn't necessarily accurate, but what they are seeing can absolutely be real. So do your best to recognize what could authentically be going on, and then make a treatment plan. If they're saying, I feel something inside that doesn't belong, that wasn't there before, okay, we can do an x-ray, we can do an ultrasound. Maybe what you're feeling is that there's one big kidney and there's a smaller kidney, because maybe the smaller kidney is not functioning well anymore, and so the other kidney's doubling in size to do the work. That's a normal physiologic change. But to someone who doesn't recognize or know why, suddenly they're feeling what feels like a big egg inside the abdomen. That's going to be alarming. Again, maybe it's parasites, maybe it's tapeworms. Proglottids will crawl out of the rectum of a pet after a bowel movement. Proglottids, which are what a proglottid is it's a segment of a tapeworm, and it's part of the way that the tapeworms reproduce. The body segments called proglottids break off like, how like a big long Tootsie Roll has little segments on it. So basically, like if a segment of that broke off and then was moving around looking a little bit like a maggot, That's what that is. And yes, they can absolutely move for a little bit if they come out on the countertop or in the litter box or somewhere that you'd find it. So those are real things that they're seeing. So the best thing to do, listen sincerely and use your training to think of some things that it could actually be. Could it be parasites? Could it be an abdominal mass? Could it be an intestinal foreign body? What are the symptoms they're seeing? Is it vomiting? Is it diarrhea? Do diagnostics to try to determine the origin of those bona fide changes, and then explain to them the treatment protocol. Okay, yes, we did a fecal analysis. You're right. There is something that doesn't belong in the feces. And you're right. In extreme cases, it can get into humans. So good job noticing it. So what we're going to do is we're going to give him some medicine. And then we're going to get him on more medicine to prevent fleas, because that's how they typically get these inside, is they hide inside fleas. And then when they are grooming and eat a flea, that's how they get infected. So we'll prevent fleas, we'll kill off what's inside. And in the meantime, I want you to practice thoughtful hand washing every single time after you clean up after him. So, because soap is very efficient at killing a startling number of things.
Excellent. Thank you. All right. So this is for Dr. Davis and Dr. Lehto. So what would be the appropriate response from a mental health perspective?
Well, I'll start out. I agree with what Dr. Hoggan said is, when something's going on with their pet, don't try to argue with them. But what I might do to let them know that I'm taking them seriously is really have them describe what they're seeing. I might even do some Googling with them and say, like, does it look like this? Is this what's going on? So they know that I'm really believing them. But if they have a known diagnosis, let's say of schizophrenia, I may also say to them, listen, I hear you. I believe this is what's going on and we really need to figure it out. I also think that your schizophrenia may be making this more difficult to deal with this situation. And so as a psychiatrist, I will probably also be trying to focus on, can we get you back on the right treatment or something? But not arguing with them about it, just saying, I think this may be making the situation worse. I do want to find out if they're doing anything about the aliens, because sometimes when people have delusional beliefs, they may do things that could potentially be harmful to their animals. So, they may be trying to wash out their mouth with bleach or something, not intending to harm their animal, but, based on their beliefs, this feels like it might be good. And so, I want to find those things out so that if they are happening, I can maybe help them come up with an alternate strategy, or if they're doing something really dangerous, then intervene in a more strict way. But the other thing I would do is help them talk or think about how they can go to a vet and be taken seriously, because I know that many of my patients, especially if they are delusional, will go to a vet and just be dismissed. And really something is going on with their animal, but because they presented so bizarrely, they weren't taken seriously at all. And so we might even role play. What are you going to say to the vet? And, you might not say this thing because that's going to sound strange. I know it's real, but don't say it like that because it's going to be heard like this. So those are my thoughts. I don't know, Stephanie, what other thoughts do you have?
Yeah, and in thinking about making the plan and doing the role play, something I might do is type out a document of like the symptoms that are happening, so that if any barriers in communication can be addressed in that way. I think that also is just truthful in all situations. I would also try to address I'm thinking about just in general, but address some of the vulnerability factors that may be impacting what is coming up for this individual. So I would see if we can focus on general strategies to help, like Rachel said, like see what we can get back onto the treatment plans to do the treatment planning of addressing sleep, addressing hygiene, addressing eating, all of those things. I also wrote down that I would refer to Rachel for medications. So I would also do that.
Oh,
Thank
one
you
more
very
thought
much.
is
Yes.
if they have a family member or a friend or someone that they're close to, you can always see if they'd be amenable to involving them as a support person, who can also make sure the animal is safe.
Absolutely. Absolutely. Thank you. All right. Are there any questions or comments from the audience?
We have two more scenarios.
We do. All right. So I will go ahead and move on. This has been very fascinating. I am resetting my little timer here. All right. The veterinary clinic was a hub of activity as John, a veteran with severe post-traumatic stress disorder, entered with his PTSD service dog, Rex. Rex had a wound on his paw, and while John knew it needed attention, the thought of being separated from Rex in the clinic filled him with anxiety. Rex was not just a dog. He was John's lifeline, trained to help manage his PTSD symptoms by providing comfort and security. John's symptoms worsened every time Rex was not by his side. Coupled with the worry over Rex's wound, he verged on a panic attack. As they approached the reception desk, John's apprehension was evident. The idea of Rex being taken to the back for treatment without him was almost unbearable. So my first question is for Dr. Hoggan. What tips do you have for veterinarians in these sorts of situations?
There's a couple things. One is it is 100% reasonable and valid for a client to say, I cannot be separated from my pet, especially if it is a service dog. So we need to be respectful and mindful of that. Yes, many hospitals do have policies where owners don't come to the back, but there are exceptions to rules. And you need to be realistic and understand that if this individual has severe enough PTSD that they need to have their service dog with them, you are placing that individual and potentially others in a bordering on dangerous situation if they authentically become triggered and highly reactive. So an ounce of prevention, just listening to the person and saying, you know what, I don't want to be separated from my pet is okay. The other alternative to that is there are some veterinary hospitals that are changing the way they do things and keeping people and pets together. So you can always do a Google search for veterinarians near me that don't, that keep people and pets together.
Mm-hmm.
And, you may be able to find one, and then that becomes a non-issue. So just understand that that's also an option. So if you can't find one nearby that doesn't do a separation, then talk to the veterinarian, talk to the clinic, maybe call ahead and say, my dog cut his foot. He clearly needs stitches. I'm a military veteran and this is my service dog. And if he's not by me, I tend to get triggered. And I especially get triggered in medical environments based upon my history. So I need to be kept with my dog at all times.
Mm-hmm. Mm-hmm. Excellent point. And from the pet's perspective, what considerations need to be made in this scenario?
That dog is a working dog. That dog is not a pet. So that dog feels very much that it has a responsibility to do, and it takes its job really seriously. And so if that dog recognizes that his owner is starting to escalate, that there is starting to become an issue, then that dog is going to escalate as well. And it's going to be much more difficult to handle and to manage. And you want to keeping them together is going to be better for everybody, because it's better for the dog and it's better for the client, because then the dog's going to be much more calm as well, because they feel safe with their owner. Even if it's not a service dog, they feel safe. They know that nothing, that the owner's there to continuously soothe them and reassure them, and they can also assist, like if the dog does need to be muzzled, the owner's able to put the muzzle on much better than a technician or a veterinarian is, because then the dog feels like it's being potentially assaulted as a muzzle's being placed over its face, even if it's done gently.
Yes, thank you. And I just had a thought too when you were talking. So in terms from from reception and how reception can handle these situations, do you have any advice for preparing your staff for those types of situations?
I think it's about communicating and making sure that people understand that these dogs these aren't pets. This isn't somebody who is treating their dog like a fashion accessory and saying, no, my outfit just won't match if I don't have my dog. It's a bona fide medical situation, and that animal has to be kept with that owner. And we need to be respectful, even if we don't understand it. It's not up to us. We have to treat them with kindness and respect what they are telling us and respect the needs of that dog and that client.
Thank you. All right, now for Dr. Davis and Dr. Lehto, what tips do you have from a mental health provider standpoint?
Do you want to take the first stab at it?
Sure. So I love good direct communication and advocating. So I think my first thought is advocate for yourself and for your animal. So Dr. Hoggan had a great suggestion, call ahead, see if you can say something, talk to the reception or the vet or whoever it ends up being and see if there are options that are available. In general, I would also be working on how can we handle things not going as planned, and when you're not listened to, what are your other options? So if someone's not going to be able to let you go back with your service animal for whatever reason, okay, what are next steps? What can we do? Can we find somewhere else? Are there other places that are going to be able to do this? Like, how do we manage this so that you and your, well, in this case, Rex, are able to get the best care possible, and make sure Rex is taken care of, because obviously that's really important. Rachel will probably talk about medication, so I won't touch on that. But then I think, kind of going back to thinking about how can we appropriately advocate for ourselves and think about escalating. Escalating doesn't typically work. So for both us as individuals who have pets and also veterinary professionals, like escalation doesn't necessarily work, and saying, no, I'm right, doesn't always work as well.
Yeah, and I'll just talk about, this isn't the same scenario, but it's another scenario where, so I have a blind, deaf, senile 15-year-old Maltipoo who I know that if she goes to the back, she's going to scream and flail and injure herself. And her veterinarian is wonderful. It's Alameda East. They are a very high intensity sort of setting, though. So I know that when I go in with her, not everybody's going to know her and they're not going to know this about her. So I just having a phrase I can say, so they're going to come out, they're going to want to rush her back. If I can just say, can I tell you something first? Like, she's senile, and if you take her back there, she's going to like thrash around in that kennel and she's going to hurt herself and she's going to scream the entire time. And so usually when I say that, then they are flexible. And so what they've done is they've let me sit with her in an exam room, and then they do everything possible in the exam room, which then prevents her being sedated. It prevents her from screaming. You know, there has been a time where they did just take her back anyway, and she did this scream and thrash, and they recognized it quickly, and they brought her out and said, okay, yeah. But I think advocating for yourself, but sometimes even just being able to get in, can I just tell you something first? Like, your life is going to be easier if we can keep her with me. In terms of PTSD, either for the person with PTSD or for an animal. So if I have enough, I'll talk about the animal first. If I have enough notice that I'm going to need to go into the vet, sometimes you can pre-medicate your animal. So like a little bit of trazodone or a little bit of clonidine can really help calm the situation down. Now, you don't necessarily have that luxury if it's an emergency. And then for the person, like if I have a patient who knows what their triggers are, knows what stressful environments are, not only will I help them learn like behavioral or cognitive strategies to use, and may give them a medication that they can take on an as needed basis. So something like hydroxyzine or a beta blocker, or, you know, rarely like a benzodiazepine, or sometimes an atypical antipsychotic, or something that they can take proactively to kind of help calm down their nervous system and help them manage the situation.
very much. Are there any questions or comments from our audience? Either live or on YouTube? Stars as well on the panel. All right, thank you so much. All right, so for our final scenario, oh, precious. Those are beautiful, beautiful. All right, the veterinary
This
clinic
is
was
Spooner.
quiet. The veterinary clinic was quiet when Maria arrived, her arms cradling a small cardboard box. Inside lay her beloved cat, Whiskers, who had passed away during the night. Maria's eyes were red and puffy from crying, and her shoulders slumped with the weight of grief and embarrassment. As she approached the reception desk, Maria's voice trembled. She explained that Whiskers had died at home and she didn't know what to do. The pain of loss was compounded by her financial situation. She could not afford the cremation services typically offered by the clinic, and burial at her apartment complex was not an option. So, Dr. Hoggan, how do you handle this scenario if they come to you as a vet?
So part of it honestly is company dependent. I have previously worked for a large company where if someone came in and had severe financial constraints, we would do group cremation, meaning that the animal was cremated with other animals and remains were not returned to the owner as a service and not charge them. If they want the ashes returned, however, then the client was required to find the money to pay for that. In those circumstances, I think most people could probably do a GoFundMe or something, hopefully like that, to be able to raise that money. I think that if you are in that situation and the veterinary clinic cannot help you, ask them directly for the name of the crematorium, because most veterinary hospitals contract to a crematorium, and speak with the crematorium directly, or have your client speak to the crematorium directly and explain the circumstance that there are severe financial constraints and they don't have a place to bury them, but they need help, and this was a beloved family member, and they just they'd like to have the ashes returned. And at my current company, we feel like there's a moral and ethical obligation to help people and their pets when they need it most, and so we do our best to help people. And that may, again, that's kind of company dependent, but in most of the circumstances that I know of, you can at least get some help. And then going directly to the crematorium if the veterinarian won't help you is most likely the best bet.
Thank you. Wonderful advice. All right, for Dr. Davis, how would you handle this scenario if they came to you in your office, the owner came to you in your office?
Yeah, so let's say I had a patient who came in, and at the end of her appointment, she told me, oh, by the way, Whiskers died. And I happened to know that Whiskers was her cat that was very important to her. And other than being like, why did you wait till the end of the appointment to tell me this? I was also like, well, where is Whiskers? And she said, well, she's in a shoebox in my apartment, but I'm gonna have to put her in the dumpster. And so I think the first thing is watch yourself. Like, don't judge that. This is that person's reality. And it's as horrible as it may feel to me that they're going to have to put their cat in the dumpster. Like, that's the reality. So I fortunately tend to keep like a bunch of random tokens by my desk. And so I happen to have a mouse. And so I thought, well, I asked my patient, I'm like, are you into symbolism? And she was like, well, yeah. I'm like, do you think Whiskers would like to be buried with a mouse? And she was like, yeah, I think Whiskers would like that a lot. So I was able to give her this little metal mouse and had a little statement, and she could take it home and then put it in the shoebox and put Whiskers in the dumpster. And so it was a lot of like quick thinking, like don't judge, like how can you make the situation meaningful? And if you don't have tokens, there's still probably something you can do to symbolize or to honor or to respect, whether that's writing a poem or finding some like pretty grass outside to put in the box with her, or, something that helps them feel like they're doing something to honor that feels meaningful to them and that what they're doing is not shameful either.
Thank you. Wonderful suggestions. And Dr. Lehto, from a mental health, from the patient perspective, what recommendation from a mental health standpoint would you give to the owner?
Yeah, I would really kind of similar to in line with what Dr. Davis was saying was try to find a way to memorialize whiskers. That can be anything to anyone, and really how this might be a way to remember your pet. I mean, I would normalize and validate that financial concerns are such a very realistic aspect of everyone's life. And when you think about your pet, this is not the thing you want to think about your financial concerns impacting. Now that I know about the different options that Dr. Hoggan gave us, I would probably try to problem solve. But I would also normalize and validate and take the perspective of like, let's go through some grief and loss processing. Let's see what we can do to help you really recognize that you loved Whiskers and you did the best thing that you could taking care of Whiskers the time that you had Whiskers. So let's focus on that versus right now, like we can problem solve it. And then I'm thinking down the line, let's focus on how you were able to take care of Whiskers.
And this may sound a little bit morbid, but also freezers can buy you some time. I mean, for like several years, I had like 12 small animals in my freezer until I decided exactly what I was going to do with them. So if someone really feels like they can't make a decision, I
Would
guess
not
that's
have
hard
thought
if
of
you have a
that.
large dog, but like a cat
Yeah.
or a smaller animal.
If you have an 80-pound, German Shepherd, it's
Yeah.
probably not going to fit in your freezer.
No.
But
I can tell you though that you could potentially talk to veterinary clinics in the area and see if you could pay a holding fee and see if they could potentially, get you 2 weeks or something like that because you can reach out to family and friends, you can find out what costs would be and work, and try to raise the cost for private cremation in that, in that time. That was a really good point.
Yeah.
Dr. Davis, thank you.
I would not have thought of that. So yes, thank you. All right. Are there any, we'll now open this broadly up to our audience. If you have any questions about this scenario or any questions or comments more broadly from our panel discussion today, we'll go ahead and open that up now. We do have some time. And again, as a reminder, if you're watching this on YouTube, please feel free to ask questions in the comments and we will routinely follow up and answer any that we see. I do want to say thank you again for all of you who did attend, and thank you for sharing your wisdom, experience, and insight. It's why we wanted to do this. So it's wonderful, and it has been an absolute pleasure to be here with you all this evening.
Right.
It's evening for me because I'm on the East Coast. But yeah.
Yes, thank you, everybody.
Yes. Can I add one tiny thing that I wanted people to know? Please tell clients, tell people that when they lose a pet or when they are losing a pet and they are getting difficult news at a veterinary hospital, they don't ever have to feel embarrassed about crying or being upset. This is what all of us there have dedicated our lives to. We 100% understand why you are sad, why you are crying, why you are upset, and you are in a very safe space to articulate those feelings.
Thank you. And I feel like a lot of people have a lot of anxiety and fears about money related to veterinary care too. And I imagine it's a similar boat that you all also understand, and there's nothing to be embarrassed about. Yeah.
There are financial realities that dictate decisions in everyone's life. That's the very hard part about being an adult. Yes, you can eat candy whenever you want, but you still have to pay the bills. And so it's okay if you cannot afford the A1 treatment plan. Talk to the veterinary hospital, explain the circumstance. I desperately want to help my pet. Here are the financial realities of my circumstance. What can we do to make a difference today? Pain medication, anti-nausea medication. Are you looking at comfort care? Are you trying to do a hospice type of scenario? Those are all valid realities that are okay versus trying to do something that that is going to push you into a bankruptcy. And it's not a measure of your love for your animal. It is the hard reality of being an adult, and nobody thinks otherwise because we all have bills. So it's understood.
Thank you so much.
Thank you.
So I
Bye.
think that gets us close to time anyway, but unless there's anybody else who had any more comments or feedback.
We're good. Thank you, everybody. And please subscribe to our channel for future talks.
All right.
Absolutely. Thank you all.
You all be
Yep.
safe. Thank you.
You too. Oh.